എന്റെ വീതികളിൽ നീ ദീപമായിടണേ. ദൈവമേ ഞാൻ നിൻ സവിധി കൂപ്പു കൈകളുമായിന്നും അണഞ്ഞിടുമ്പോൾ നീ നിൻ കൃപയിന്നിൽ തൂകണമേ.
Thank you, Anu. Now I invite Miss Grace Susan Binoy from third year BSc FCS to deliver the welcome speech.
Good evening. He who has served has hope, and he who has hope has everything. A very good evening to one and all. Respected dignitaries, teachers, students, and all my dear friends. It's my privilege and honor to welcome you all to this webinar session on the topic Nutrition Care Process, organized by Department of Home Science, Wimlar College. First of all, I'm honored to welcome our eminent speaker, the guest of today's evening, Ms. Rita Moll Sebastian, who is a registered dietitian, CDE from Ontario, Canada. I humbly welcome you, ma'am, to the webinar session. We are expecting a lot to learn from you. Next, I would like to extend a special welcome to Head of the Department, Ms. Thomas Ruby Mariama, our team leader, our backbone. Thank you, ma'am, for joining with us. Moving on, I'm extremely glad to welcome our teacher coordinator, Mrs. Moni Jeet, who provides constant support and guidance to us. Thank you, ma'am. Last but not the least, it's my pleasure to welcome all the students, teachers, and friends who have joined with us in this webinar. Thank you all for showing your interest. Health is wealth. I hope that today inspires ideas and discussions around the ways that we can keep up our wealth. Thank you, one and all.
Thank you, Gracie. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the chat box. I will bring them up during the presentation, and we will also have time for questions at the end. Okay then. Now, without further ado, we will turn the time over to Rita Moll, ma'am. Our presenter today is Ms. Rita Moll Sebastian, registered dietitian, CDE, Ontario, Canada. She completed her BSc from Alphonsa College, Pala in Clinical Nutrition and Dietetics, MSc in Food Service Management and Dietetics from CMS College, Kottayam. Was a part of faculty in 2007 and 2008 in our own college. Completed her international education Bryden program from Ryerson University, Toronto. We are really excited and are eagerly looking forward to hear from you. Over to you, ma'am.
Thank you, everyone. We'll discuss about nutrition care process. I'm hoping maybe in English and Malayalam we can discuss it. And when I was teaching there 15 years back, I was not so aware about NCP and all. Maybe things might have changed now. I did share my PowerPoint with you guys, so I hope you had a chance to review it. As Vismaya clearly said, if you have any questions, we can go back to slides and explain it. So here, what I'm trying to say means I'm trying to simply mention the 4 portions of, or maybe parts of NCP, and I'm taking you to a case study which make more sense, okay? And why NCP and what is NCP? So NCP is, I hope, I think it's still on site or online class. This is keep on changing, but I don't know. You all have access to Crossbook or Pathophysiology, some kind of text. So they do have a chapter talking about NCP, which is a nutrition care process. Okay. And what is NCP? Means It's giving a standardized form of communicating, like whether a dietitian from Canada or a dietitian from United Kingdom or Middle East or India who is writing, like when you do the process, like okay, you learned about diabetes, you learned about hypertension, you learned about low fat diet, and you have a client or a patient came to you. Once you start practicing as a dietitian, you did your nutritional assessment, you made a plan, and then it's an important fact that you document each everything. But to my understanding, maybe it is not mandatory to keep the documents of who are patients you have seen in India. However, it's always a good practice to keep a record. Maybe you don't have to give all the personal details. Let's say if it's a Shali CM, that's a patient. It's an example, okay, Shali. So you could say that patient name is S or Mrs. S or SCM, something like that. But you do the documentation for all the process what you did. So that will help you, that will aid a communication, that next time if the patient is coming for a follow-up, or if that patient is transferred to another facility, you can provide the details in the transfer note. It's not necessary that you remember everything what you discussed. So it's always a good idea to keep a record for what you did. Okay, again, so when you're keeping this document, I mean, whatever you did, how you did the assessment, what all the things you did, it should be in a standard form. Every dietitian should understand what you did. So to standardize whatever terms you are using, internationally we follow some points, or you do such things. So NCP aids that. Okay, so in short, that's a long introduction. However, in short, NCP is a framework. Okay, talking about how the dietitians do their part, how they're doing the assessment, how they do diagnose, and how they, what is the goals and what are the interventions. Okay, Adira, yeah, you can go ahead with the second slide. Okay. So again, to familiarize with the care components, it is very important to understand what is NCP. So I hope you did make a sense. I know your students, you must have started hearing about NCP, but still, it's always you have to grow a student mind in your mind. Always try to learn new things and make that eager. Like you, if you have that eagerness, even you are 18 or my age, like you are 38 or 50, there is a room for learning always. Okay, so to understand NCP, I'll go I'll go to the next slide. To understand what is NCP, you should understand what is the importance. So NCP, nutrition care process, not only aid the documentation, but also take you to the each step what an actually a dietitian do. So it has mainly 4 steps. Step 1, which is a nutrition assessment, like you do A, B, C, D, such things like anthropometric measurements, biochemical, those things, how you do the assessment, what all information you are collecting. Based on that, that's the assessment part, is basically you collecting the information. Okay, for example, somebody came and said, "Oh, doctor, no, dietitian, say that I'm not feeling well," or you get a referral that, okay, this is 24 weeks pregnant and the blood sugar level is high. That's the only information you are getting from your referral sheet. You do you need much more information to make a plan. So the teacher teaching you must have mentioned you there should be a form like a questionnaire to do the nutritional assessment, which is mentioning I mentioned you earlier anthropometric measurements, biochemical, clinical, dietary pattern, all those gathering information, and based on that information you discuss with the patient, you make the assessment. Okay, and based on that assessment you're going with a nutrition diagnosis, not a medical diagnosis. We don't have the license to do a medical diagnosis. But if we go back to the example, someone has like you got a referral for someone has a gestational diabetes, how based on that information, based on the assessment, you making a nutritional diagnosis, something like that, altered lab value. You cannot say this patient is diabetes. That's not standardized. Okay, we don't have the license whether you're practicing in India or in Middle East. We don't have the right to make any medical diagnosis, but we do have the right or clinical judgment to make nutritional diagnosis. You trying to what is nutritional diagnosis or what is the purpose? You trying to understand what is the important nutritional problem in to that patient. So in example, that patient, I'm going back to the example so that will make sense for you. So someone has a gestational diabetes. What are the issues? Main issue is high blood sugar level, right? I hope you agree with that. But maybe she also has maybe underweight, or maybe she's overweight, or she has a family history of heart attack, or maybe history of previous um, surgeries, or maybe polycystic ovary, or maybe has hypertension and some number of problems, but you prioritize which one need first attention. So or maybe so that one go important, so then you can make many nutritional diagnosis. One is maybe altered blood work or altered sugar level due to maybe her diet is not good, or maybe she's not taking the medication, or maybe she has a family history of diabetes, something. And second problem may be there may be she might have a constipation, so then we could say irregular bowel pattern, something like that. You don't in when you do the there is, so how you do that in the nutritional diagnosis, you use a standard form to write the nutritional diagnosis, which is called PES. I will explain it more. You must have seen it in my PowerPoint, which is called problem, etiology, signs and symptoms, PES statement. By writing a PES statement, you are making a nutritional diagnosis. Okay, I'll explain it more. I know it's all different, but it makes sense when I take you through the case studies. So then steps 3, based on the nutrition intervention or maybe the important nutritional intervention diagnosis, you're going through a plan, thinking how you are going to make a goal, or maybe how you're going to proceed it, such as short-term plan goals or long-term goals. So if that lady is 26-week pregnant or 24-week pregnant, and her blood sugar level is high, then you make the diagnosis that altered blood sugar level, and then you making an intervention that first short term goal is to maintain blood sugar level in the not normal, but something more controllable. Okay, so it's not tomorrow it's not going to have a normal level, but we try small steps, something maybe eating more whole grain food. So that is one short term goal. Okay, so maybe with many short term goal, you going through a long term goal, which is manage blood sugar level, or maybe optimum blood sugar level throughout this pregnancy, so that you can prevent having a big baby, or maybe complication with the diabetes or stillbirth, such as. Okay, so that is the long term goal for that person, but the short term goal may be eating a whole grain chapati or whole grain, or having whole fruit instead of juice, or having more frequent snacks, yeah, healthy snacks, or a junk meal, or taking medication. That's a medication part, again doctor will take care. We only take care of the small steps. Okay, so that is the intervention part. And the final part is nutrition monitoring or evaluation, which means you made the goals, discussing with the patient what is doable, and then based on that, you making a plan how you're going to monitor, checking the blood sugar level daily, or maybe coming back after 2 weeks, and checking the ultrasound, um, see what is the baby size, or maybe see how often she's urinating, or good sleep, such as like some scenarios how we are going to monitor. Okay, and then based on that, you can make out whether this goal was doable or it was a failure. Okay, so to do our work in a correct way, this NCP will guide us so that we don't miss any part. And again, it's not like someone is saying you have to go through this, but this will give a framework. Okay, as a dietitian, when I get a patient, I have to do a assessment, a nutritional diagnosis, intervention, and nutritional monitoring and evaluation. When I complete that, you document it, then that you have done the nutrition care process, and you have to keep that document. So that is a complete process. If you miss one part, then that's not complete. Okay, so including that 4 steps, that's is shortly NCP. Go ahead with the next slide, Adira. Okay, so this picture I got it from, yeah, slide 4, I mean. Okay, so this picture I got it from Crow's book. You can see um, that NCP model. Okay, so it's like a 4-section assessment, and nutrition assessment, and again it's also called reassessment, right? So as I mentioned earlier, obtain and collect important and relevant data, and analyze and interpret collected data. Okay, and once the step 1 is done, we're going to step 2, which is we making a nutritional diagnosis based on PES, problem, etiology, signs and symptom. Based on the nutritional diagnosis, you go into nutrition intervention. That means based on your critical thinking and evidence-based practice, you making determine the interventions and the prescriptions, and formulate short-term and long-term goals, and determine what actions you are going to take, and implement those action. Okay, once the stage 3 or step 3 is done, we're going with the step 4, which is nutrition monitoring and evaluation. So in that, basically you select or identify the quality indicators, which means how you're going to monitor, evaluate the um, progress, or maybe not progressing. So okay, you have to think about in both scenario whether they are, is that working. Okay, if it is, that's if example, if it's you have you seen a patient and then you did all this but it did not work, so that's the area. And that picture say reassessment. Okay, you reassess what was going through. Did I missed anything? Did I this goal was not attainable? What was the problem? Okay, what was the issue? Okay, now again we're going more detailed. Okay, go to the next slide, slide 5. Hmm. So as I mentioned, in nutrition assessment, obtaining the data, right? Okay, which is and very important. It has to you don't need unwanted data. So how many dogs you have, do you raise cows? No, you don't need unwanted data to save our time, to respect everybody time. That's why the beauty of using the questionnaire, right? Every dietitian has to formulate a questionnaire which is good for them. Okay. um let me finish this slide and I'll come back to Nihala if that's a question. And in the nutrition assessment, I already mentioned when you make a questionnaire. So I think who are teaching the dietetics or nutrition can ask the students to do a small project, make a questionnaire. So when I was a student, I started making a very brief, very simple questionnaire. But then over the time, over the past 15 years, I have my own handy questionnaire, which whatever information I needed and what is the plan. So this will actually help us to go through each. So every patient is coming, you go through all this assessment sheet or maybe questionnaire will help you. Okay, did I miss anything? Did I miss anything? So you start making a questionnaire, even though you don't know anything. That's okay. That's a fresh paper, plain paper. You start making your things. Okay, what all information? So all these points will help you to make a questionnaire. Okay, so you could do a project or a small assignment to make a questionnaire for these NCP, or maybe at least for the assessment part. So things should have is anthropometric measurements, which means your height, weight, waist circumference, hip circumference, all those information, and you calculate the BMI. Those information has to be in the anthropometric measurements. Second is biochemical data, something like what is the blood work, what is the A1C, and the blood work if it's a sugar patient, if it's available A1C, what is the A1C, what is the fasting blood sugar, what's the prandial, random, cholesterol, thyroid, all those lab values. And in clinical findings, you look for the physical appearance. Do they have any swelling? Do they have any temporal weight loss? Do they have any pale, like when you must have said, okay, someone has anemia, or someone has a nail is like no red, or maybe you look for the physical. Okay, that is the clinical findings. And then you go for the diet or nutrition history, which just means, are you a vegetarian, are you a lacto vegetarian, do you have any food allergy, what did you eat in a typical day, and do you dislike any food, do you like any food, is there someone is cooking for you, or you go for eating from outside often, those things. Okay. And next is the client history, which is talking about do you have any other information, like, do you had a history of ulcer, or do you have you been hypertensive, or any other related to um, nutrition. You ask for that history. Okay. Is that a question? Somebody, I think someone has raised their hand. Is it an by mistake, or it was soon? If it's that important, I can answer it now, or maybe we can discuss it end of the session.
Ma'am, it's by mistake.
It's no problem. No problem. It's okay. I just thought maybe did I made any mistakes or something. Okay, well, go to the next slide. Yes. Okay, so once you gather all the information, based on that information you have, you're going through a nutritional diagnosis, which is identifying a condition, and you looking for what are the signs. Okay, so as I mentioned, it go by PES statement. Okay, and which is problem, etiology, and signs and symptoms. Okay, and when you write the problem, it's I don't want to go through too much complication, but still it could be an intake problem. The intake problem means depends upon what you are eating. Is that um like poor appetite, or is that missing teeth, or is that any maybe swallowing difficulty, which is called dysphagia, right? Dysphagia means swallowing difficulty. And feeling full, like if someone, you're talking about a senior like who's old and they don't have much appetite. So that's all things, it's intake so there is four domains to write the problem. Just mentioning, okay, it's not in the PowerPoint, but I thought I'll just worth mentioning that. So it's like if it's somebody's problem is something depends on what they're taking it with, that's the intake problem. And intake domain are sometimes it's something they need knowledge. Someone is not eating a balanced meal because it's a convenience, so then what is the problem? Then that's that problem, that's the concern is not related to intake, that's related, you need to provide nutrition education. Okay, so or maybe someone had a surgery, like let's say someone had a cancer and they removed a part of the intestine, which is maybe altered GI. Okay, GI means gastrointestinal. Okay, if it's any acronym, you didn't understand, I can explain it. Okay, maybe I might use, because it's like every day you're using and you expecting others also should know, but never mind. Okay, if they didn't make sense, let me know, I can explain it. So based on you trying, these all things will help you to understand what is the problem. So is that making intake is the problem, or maybe knowledge is the problem, or do they have any deficiency or intolerance, that's a problem. You trying to understand, and then you see what is etiology, means reasons. What is the reason? Why it is happening? Like someone has a abnormal blood work, why? There you could mention the disease name, because of the gestational diabetes, or maybe not eating properly, or eating too much saturated fat or fatty foods. And how blood sugar level like 8, or A1C level 12, or maybe delayed wound healing. You see what is the problem. So when you collect all the information, you see the physical finding, and see there's some a wound which is and you see when was this cut made, or say 3 days or 4 weeks, and then your critical thing is that why it's not healed. Maybe they don't have not see when I explain it. So as we were discussing, me and Shali, Shali, you are my guinea pig today. All the example I'll make with you. Just bear with me. So she is PhD in gestational diabetes, so that means she is pro in gestational diabetes, and that's why I took that example. So I said, okay, you were the best person to talk, then why did you call me? So she said, it's difference between practicing dietitian and someone who is teaching. So I that's actually makes sense. When you are a teacher, or maybe mostly when you teach something, you explain, okay, you make the problem, you make the etiology, you make the signs and symptoms. But when you practice, that's not always that say scenario. You might not have the recent blood work. So what do? You cannot give up on your patient. You see what is the available resource. Maybe then if it's a blood work is not, you don't have, or maybe the patient don't have the money to go blood work, or maybe because there is COVID and the lab is closed, you cannot give up on your study. Or maybe you are doing online service. So then you look at the clinical findings. So that's why there is a reason why you are gathering all those information. You see what all the information is there. What is the weight before pregnancy? What is the weight now? Are they gaining too much, or are they not gaining as supposed to be? It's just the 1 kg, and then you could see, do they have a too much vomiting, or maybe do they have any clinical signs like a delayed wound healing or increased urination, increased appetite. So that's why you should know the reason for each disease. Like, what are, like, diabetes, if it's, for example, diabetes, if it's easy to, what is diabetes, what are the signs and symptoms, and what is the blood work you should be looking, and how you're managing. So this is the reason, each disease. Like, someone has a heart attack, so what is heart attack, what is the reason, and what all things you need to look into that, to identify what are the possible problems and what are the medications can interact or issues, and how you can help it. So you should know the signs or the reason for each disease. Okay, so that understanding that will help you to fill the S means signs and symptoms. Okay, so I made 2 examples. So it's like a inadequate oral intake, that is the problem. E, related to now the etiology part, intake less than 50% of estimated nutritional needs. So for that, you should know what is somebody's nutritional needs, recommended dietary allowances, right? So a pregnant woman, what is their need? Are they meeting that need? So you should do all those calculation during the assessment part. So inadequate oral intake, that is the problem related to poor intake. I could, if I am not experienced, if I don't just didn't give all the, so I could say poor intake. No, that's not be specific. Instead of vague language, intake is less than 50%. You giving the information exactly, are they taking or not taking, and how much is that. So then that's the issue is important, because they are not even eating half of the needs. So then there is a issue is important to, so you trying to articulate the severity of the problem. Okay, intake less than 50% of estimated nutritional needs, as evidenced by significant weight loss of 7 kilo over the past 1 month. Again, how you know if someone had a significant weight loss? So basically, there is a calculation here we used in Canada. So someone has a 5% from what was their usual weight in 1 month, or 7.5% weight change in the past 3 months, or 10% weight change in 6 months is considered as a significant weight change. So if it is 5% in 1 month, 7.15% in 3 months, and 10% in 6 months is considered as a significant change. And that's why in the anthropometric part, the assessment, it's important to see what is the current weight and what was the usual weight. See, it's very vital what all information you are collecting it. Otherwise, you're missing the important part. You didn't ask the current weight, or you say that you don't, if the patient does not know what is the current weight or what is the usual weight, then you're missing something important. Okay, and the next example is swallowing difficulty. As I mentioned, dysphagia. Okay, so what is the problem with the dysphagia? You're not a doctor, you're not going to correct someone swallowing, you might think, but you do have a big part in the swallowing difficulty. You could alter the texture, the diet texture or fluid consistency to help them to eat what they can tolerate. Okay, so that's very important. Look, I also work in a long-term care home for seniors, so most of my we say residents, which means the patients, okay, has swallowing difficulty as a side. So in this scenario, you should know what is stroke and what is the side effects of stroke and what is aspiration pneumonia. So aspiration pneumonia means food and fluid is going to the wrong direction, which is to the lungs, and food has to go the esophagus and to stomach. But if you have a swallowing difficulty, means you're like swallowing need 200 muscles, right? If it's some of the muscles is not working properly because of the cancer or because of the dementia or because of stroke, whatever the reason possible, swallowing difficulty. Another thing is, you see someone had a stroke or someone had a oropharyngeal cancer, you should automatically think that, oh, there is a possibility of swallowing difficulty, right? But also it's not necessary someone had a stroke, but not necessary they had a swallowing difficulty, but you should think there is a possibility. So you should ask, do you have any difficulty with the swallowing? They might say no, I eat. So but then you have to ask, how you know if there is a swallowing difficulty? Then you say that when you eat, do you cough? Or when you drink water or tea or ice cream, do you cough? So these are the signs and symptoms. Or let's say I could write that this same situation, swallowing difficulty related to mm, oropharyngeal cancer or same as a stroke, as evidenced by coughing with the regular fluid or coughing with the rice or chapati with the food. You could say it. You don't have to be all the time aspiration pneumonia, okay? So then you it will help you to understand what is the problem. Then you can plan your things. Go ahead with the next slide. It was little it was little long, but I really want to. This is actually worth in your future. Mm. So once you did the assessment, once you done the diagnosis, now you have to go to the nutrition intervention. So you are planning what to be done, whether is that intake problem or do they have a behavioral problem, means the knowledge has to be changed, or is there an environmental condition, whatever is issue. Based on that, you making the plan, or say you setting the goal to understand, to make them to understand what is the issue. So and then communicate with that plan. Again, you just, even your scenario, you're working in Westport and you have a patient came with the like or constipation or maybe poor intake or weight loss or whatever it is, then you assist and you made a diagnosis, and then you're going to say that, okay, so you think and you see they don't know what is the food high in fiber, or they don't know what food can help them to lower their cholesterol. So then you see, oh, there is a knowledge gap. Then you need to plan what is the, you have to give a nutrition counseling. Maybe somebody, like example, if I have a problem, I might not need a nutrition education because I have a 20 years of experience with the nutrition and related, but I might not need, maybe I might need a enteral feed because I have a swallowing difficulty, I have some issues. So maybe you see what is the problem. Sometimes knowledge is not the problem, sometimes some other issue. So based on that, you if you are an inpatient hospital, like you are an inpatient dietitian, you don't have the responsibility to give the education. Maybe that is handling by outpatient dietitian, like all the nutrition education are by outpatient dietitian. And then you only take care of whatever food is served from the kitchen, or you only taking care of what it is enteral feed. Then you and you have a referral that, okay, Rita, there is a patient in unit B, had a surgery and plan a enteral feed. What do you plan? So to plan that, still again you need to go for the assessment. What is the issue? Okay, they had a cancer, or maybe they had an ulcer, to what an ulcer, removed a part of the stomach, and now they have to go for and feed means tube feed. Okay, again it's a tube feed, so it's a nasogastric feed or maybe jejunal feed or gastric feed. Based on that, you see what it is the problem, and you make the intervention. Okay, and in the intervention, based on the reason, you see if it's a food and nutrition uh, delivery, like what form is the needed, or is there education or the knowledge gap, or are we going to give a nutritional counseling, and if it's a counseling, how many sessions they need. Like, if you have a, don't give too much information at one session, means the patient might get overwhelmed, right? So you give what is most important. Okay, avoid sugars, go for a walk. These are the two sessions we are discussing now. Come back after 2 weeks and we'll discuss it. When they come back after 2 weeks, you say, oh, I have problem giving up sugar, so do you have any other option, the patient is saying. And then you custom their plan. Okay, and then you coordinate. Okay, go you check with, inform the doctor that we did discuss this, and for next session can you do the blood work, or like, we'll say interdisciplinary team. Okay, I think that's too much info. You might get confused, but in short, intervention part, you are fixing what you are doing, what is the short term goal and what is the long term goal, and then you discuss with the patient. Okay, and the go to the next slide. Adira? Okay, so nutrition intervention and evaluation, the last part is, as I mentioned, you're going to decide by checking the blood work after 3 months. I will see my goals did worked, or it was a failure, or you check the blood work, or maybe you check the food intake, ask them to keep a food diary, you see what it is eating, or maybe you ask them, what did you learn, did you start making all those. So then that's again helping you to understand or fix. These are the things you're going to follow up. Okay, go ahead with the next slide. So these are the 4 points of NCP. Okay, go to the next slide. Okay, so this is a case study. When I was doing my bridging program at Ryerson, I have to do a case study. So it's again simply, it's a 45-year-old man with a type 2 diabetes with a poor glycemic control, means in not controlling the blood sugar level. Okay, and I'm collecting all. So these are the information, you have it in your referral. So what is the past medical history, which is diabetes for past 10 years, hypertension, high cholesterol, and obesity. Family history, both parents are diabetic. Social history, work as an accountant, live with wife and kids at home, smoking 1 to 2 cigarettes per day. Alcohol, it's 2 to 3 glasses of vodka per week. Physical activity, fairly sedentary. Next slide, please. And this is the anthropometric measurements: height, weight, waist circumference, usual body weight, and see, gradual weight gain noted since last 6 months. That's the important things you already mentioned. And then lab value, this is actually Canadian. You can imagine this is the Indian. Fasting blood sugar, hemoglobin A1C, LDL, triglycerides, blood pressure, HDL, total cholesterol, all those. The medications. What are the medications? Statins, Ramipur, Glumetza, Novamix, Glyburide, and Metformin. Okay, so important medications you should know what they are used to. Please go ahead with the next slide. I think we're running a little slow. Next slide, please. Okay, so then you go for the diet history. So what they eat, 7 a.m., what is the breakfast, lunch, 5 p.m., is there any snack, 8, 11 p.m., what they do eat, all those information you have to collect it. Next slide, please. Next slide, please. Yeah. So here is the NCP. So the first information, in ideal scenario, you got all the information. Suppose you don't have all the information, you have to collect all the information, right? So that's what, in the questionnaire you collected all the information, and you are going to do the assessment, which is based on the anthropometric details. You are taking an anthropometric assessment. AX stand for assessment. So the BMI is 36.0 kilogram per meter square, which is coming to obesity 2 category, very high risk of developing health issue. And the percentage of change is 13.6 percentage increase in past 6 months. I did mention you 5 percentage in 1 month, 7.5 percentage in 3 months, and 10 percentage in 6 months, considered as a significant change. For this patient, 13.6 percentage in 6 months, which is a significant change. Waist hip weight circumference, that is 102, increased risk of developing health problems. So BMI and the weight circumference comes under very high risk category, right? Next slide, please. And based on the lab, you see the fasting blood sugar level is 10.3. The normal is has to be 7, and A1C has to be less than 7 percentage, and it is 8.5. Blood pressure is 125 over 85, and the target, if they are hypertensive, the target is 138. If it's not, if it's like for a normal person, it is 120/80. But if you're diagnosed with as a hypertensive, the target is 130/80. And same with what is LDL, triglycerides, HDL. So it's borderline or fairly under control. Next slide, please. And this is a medication assessment. Okay, Glumetza is for lowering the blood sugar level or anti-hyperglycemic agent. Novomix is an insulin. Ramipril is for hypertension. Atorvastatin is for cholesterol lowering medication. Okay, next slide, please. And and you also see if is there any medication interaction with any food. Some food might have issues with the grapefruit, or some medication has to be taken empty stomach. All those also, you when you do the medication assessment, check that point also. Okay, and this is our dietary assessment. So based on what they eat, typical 24-day, you came to an conclusion that based on the client report, excess calories, excess sodium, and less vegetables and fruits, based on Canada's food guide, which is because I'm just quoted Canada's food guide. You could say RDA, recommended dietary allowances. And again, as I mentioned, you should know what is the requirement for each category. So estimated nutritional requirement, I use Mifflin-Singer equation to calculate the calories. And fluids, you could use 1 ml or you could use 25 ml, whatever equations you can use. We do have lots of equations, right? You can double check with the Crossbook. I guess they do have estimating nutritional requirements. There is a chapter. Protein based on what is their needs, means are they underweight, do they have any wound, do they have any protein energy malnutrition. Based on that, you calculate the protein needs. Fat, same with the fat, carbohydrate, sodium, fiber. Okay, next slide, please. Okay, so this once you did the assessment part, you're going through the nutritional diagnosis. So, as I mentioned, we are trying to make a PES statement: problem, etiology, signs, and symptoms. Okay, so here I try to write excessive energy intake related to consumption of large portion of meals as evidenced by usual diet history 3680 kilocalorie as to compare his energy requirement is 2714. Okay, and high BMI and the weight gain and other possible PS. So I did not write he is hypertensive, or I'm trying to understand what are the important problems. So for me, that time is he had gained weight and he's eating much. So that could be the reason for an abnormal blood work. I can make so many nutritional diagnoses based on abnormal blood work, but I'm just trying to give two examples here. Next one is excessive sodium related to high consumption of processed food, quick service restaurant. As evidenced by Klein report, estimated sodium is 4,000 milligrams per day compared to the recommended sodium intake is 1,500 milligrams per day. Okay, next slide, please. Okay, so here is the intervention, or I would say plan step. So long-term goal is reduce energy intake 500 to 1000 calorie to facilitate a weight loss 0.5 kilogram per week for having further weight loss 5 to 10% in 6 months. That is my long-term goal. How you are going to get that long-term goal? Doing such recommendation: pack a lunch from home because he is eating from outside. For sad scenario, pack a lunch from home with 1 to 2 servings of vegetables, whole grain bread, pasta or rice, 1 serving of lean protein, a minimum of 2 servings 2 times per week, and have less processed food. So that is one idea we discussed with the patient, and he agreed to do that. So that is one goal. And next one is to reduce the portion size of meal. And like for example, he used to have like 2 sandwiches, give 1 sandwich. So that means you're trying to reduce the quantity. Next slide, please. And this is the short-term goal. Short-term goal is to reduce the sodium intake. That's again another short-term goal. Reduce the sodium intake to range of 1500 milligrams. Recommendation to replace the processed food with fresh and low sodium homemade meals. Read nutritional labels like see what is that food is high in sodium, or how is that too much processed or less processed, all those. And to add 2 servings of fruit as a snack in the afternoon instead of maybe a chips bag of chips. Eat a fruit. Okay, so these are the some things he could do it. So that's a short-term goal, like immediately they can do it. Next slide, please. Okay, so it's okay. You should have many long-term goals and many short-term goals. So I'm just trying to identify different aspects. Okay, so if it's because, as I mentioned, he is sedentary active, right? So one of the other intervention could be long-term goal is to increase physical activity to help to meet the exercise guidelines, which is 150 minutes per week. So how you're going to attain it? So what is the goal and how you're going to attain? Join in a walking club to have 20 minutes brisk walking. So these recommendations and the goals will help you to check when that patient come for a follow-up. You can ask, okay, so did you was okay to walk for 20 minutes? You say no. Oh, okay, then you understand that's not working. So then you need to look something different. So these all points make sense. It will help to practice as a successful dietitian if you make all those things. And also it's a requirement. Okay, join the gym and use equipments under the supervision of a trainer. Next slide, please. And the short term goals: education on carbohydrate distribution, spacing and consistency, and better glycemic control. Okay, again, nutrition education is the peripheral. That's the first step you can do. Like, you, if it's a knowledge gap, you helping them to understand. But then you need to make a habit to eat healthy food. Okay, so you say, sure, education is a long process. I did mention yes, but you giving one information at a time. So you are talking about carbohydrate distribution. Okay, so recommendation is how you're going to implement that. I'm a certified diabetic educator as well, so I might overtalk. I'm trying to cut down. So introduce low, medium, and glycemic index food. Mm, so maybe they are eating high glycemic index food. That means some food will increase your blood sugar level too much. So as a diabetes people, they should limit the high glycemic food, and they should aim for low or medium glycemic food. So there is a big list. So even discussing that list is one session. Introduce consistent amount of carbohydrate at each meal and snack with the proper time. So this will help them to eat more food when that's not good. So especially when you're taking insulin or medications, you should have a consistency on what you are eating. So that will help you to avoid overeating or undereating. Okay, and enroll on a diabetic education class regarding carbohydrate distribution throughout the day. Next slide, please. And monitor. So you did all those points, and the monitor or evaluation: schedule a follow-up with the patient for 3 weeks time to monitor food intake. So that time, next time when the patient come, you ask for what did you eat on a typical day. So then you can compare it with the first food intake and this one and see, are he actually doing it? If it's not, oh, what is the gap and how I can fill that gap. And monitor the weight every 3 weeks. Again, other indicator. Indicator means how you're going to follow up. And next is follow up on lab tests suggested: lipid profile, fasting blood sugar to MD, medical director, doctor in 1 month, and LDL, HDL, triglycerides A1C in every 3 months. So these are the 4 points I tried to incorporate in a case study. Next slide, please. These are some references I took it. This next, please. Okay, so this is my email and this is my phone number. If you have any question, I can explain how I came. It was like I came here 2012, but I did so after 2008 I came to Middle East. So some of the paperwork I have done that time itself. So basically, things might change every time, but still. So when you done your graduation or post graduation, what you have to do means you should have a transcript from university. Transcript is a detailed syllabus. Okay, so you the first step is that everybody script in a sealed envelope. So that will actually help you if wherever you go, they want to know what you studied, whether the course name is like I know there sometimes places course name is home science. So home science, what did you learn from the home science? Or I did the bachelor's in clinical nutrition and dietetics, but I did the master's in food service management and dietetics. So what did I learn?